Our next presentation will be by my friend, Dr. Lauri Andress. She's an assistant professor in the School of Public Health at West Virginia University, but also holds an adjunct appointment at the Joan C. Edwards School of Medicine. Originally from Houston, Dr. Andress has been part of the faculty at WVU since 2013. Prior to joining academia, Dr. Andress worked in government as Chief of Public Affairs, a policy aide to local and congressional policymakers, and led teams from 2007 to 2010 that launched the Centers for Health Equality in Wisconsin and Louisville, Kentucky. Her primary academic interest is the social determinants of health, and she is particularly focused on the very troubling healthcare disparities which exist in infant mortality. Dr. Andress.
Thank you very much, Dr. Shapiro. It is my honor to be here and to have an opportunity to present to Surgeon General Adams. I'm very pleased to have this opportunity. I'm going to start my presentation, and I want to make sure that everyone can hear me and that the screen is up. Sound is okay.
Yes and yes.
Thank you very much.
You look great and you sound great.
Thank you very much. I appreciate it. So, social determinants of health, infant mortality, and disparities in West Virginia. During the last 20 years, we know that there's been an increasing recognition that the health of populations is strongly influenced by social, economic, and environmental factors outside the reach of medical care. In fact, some studies have estimated that healthcare access and quality are responsible for only 10 or 20% of avoidable morbidity and prematurity. On the other hand, thanks to some great work done by Robert Wood Johnson and the county health rankings, we know that socioeconomic factors and policies make up about 40% of what occurs with population health outcomes. These socioeconomic factors, which make up such a great deal of population health, rest on the ways that we structure our communities, including the distribution of resources, opportunities, and the power that we have to create safe, trauma-free places where our vulnerable populations may thrive. With that said, I want to speak about research and projects that examine infant and maternal health disparities, the role of trauma in the reproductive systems of women, and how the state of West Virginia can increase its capacity to examine these questions. The slide that you're looking at is basically a data slide. It's one that we should all be familiar with if we've been studying infant and maternal health disparities in the United States. One thing that I want to point out is that in the state of West Virginia, we tend to aggregate our data across years. So the data that you see for West Virginia is aggregated from 2015 to 2017. And then we have US data from 2018. On the right-hand side, for West Virginia, you see that the infant death rate for Black and white women is greater than the infant death rate for Black and white women in the United States. So we have this problem for Black and white women at a greater rate than the rest of the United States. But what is equally as interesting is the fact that in West Virginia, while African American women make up a smaller percentage of the population, we have this disparity in the infant death rate between Black and white women. And so what we see here is that the Black infant death rate in West Virginia, aggregated from 2015 to 2017, is 13.1 infant deaths per 1,000 births. And so what this adds up to, essentially, as the slide says, is that the chance that a Black infant will die in the first year of life is 1.9% times greater than the chances that a white infant will die in West Virginia. Next slide, please, Dr. Shapiro. And this particular slide looks at something that Surgeon General Adams pointed out and something that I discovered in 2007 during my work on health equity, which is that income and education are not protective factors for African American women as we think about these health disparities. Typically in the United States, we know that as your income increases and your education increases, you get extra protection from death and disease. This is not the case for African American women when it comes to infant and maternal health. And so what you see here again with this data is that higher education levels are not protecting African American women when it comes to infant and maternal health. Next slide, please. The scope of the research that I'm working on takes two different parts. First, in the state of West Virginia, it's important that we increase our capacity to have this conversation about infant and maternal health disparities based on race. Because of the long history of poverty in the state of West Virginia, we have documented the impacts of poverty on population health in West Virginia, but we need to go a step further and also analyze the impacts of race and racism in West Virginia. How do we have that conversation? That's an important issue. And so what I have done through my research is looked at how to create a community-based multi-stakeholder committee that includes the government, academic units, nonprofit, and clinical systems, so that we can begin to think about this issue and how we might approach it from the standpoint of the cultural toolkit that we have in West Virginia. The second part of the research that I'm conducting really looks at these factors that we have talked about, these social factors, non-medical determinants of health, and how they are impacting the reproductive systems of women in West Virginia. And so the question here is, how does race and poverty get under the skin to impact women? Looking at both Black and white women and the lived experiences that they are experiencing over time and on a daily basis, and how that impacts birth outcomes. So in this research, I'm relying on the theories around allostasis, weathering, and cortisol. Next slide, please. So again, with this slide, I'm simply emphasizing that we're looking at the factors to the right and how they are impacting the lived experiences of women in West Virginia. We have spent a great deal of time on the factors to the left, prenatal care, some clinical interventions, but today the question is, how does trauma impact the ability of women to have healthy pregnancies? Next slide, please. So this slide is a bit more complicated, and I'm going to just cover it very quickly. And I want to point out what's at the beginning of the slide and what's at the end of the slide. And again, at the beginning of the slide, we're looking at this notion of historical trauma, adverse circumstances, which may be defined as trauma at the neighborhood level, poverty, long-term historical experiences with racism. When we work that through the body, we're looking at the production of harmful hormones that are triggered that then impact the body. And at the end of that model, what you see is adverse birth outcomes. And so this model that I'm showing now is really the question that we're trying to answer at different levels, both in healthcare and in public health, trying to examine how the trauma impacts birth outcomes. Thank you very much. I've enjoyed the opportunity to speak.
That was fantastic. Both of the talks were fantastic, and I really appreciate that we are having a conversation about something that it is very difficult to have a conversation about, but that it is incredibly important that we have a conversation about. And I agree with you completely. I think we need to start helping people understand racism, or even the perceived experience of racism, still can cause trauma. And it's that trauma that then triggers these pathways. Because I think the problem is when you just say racism, people then automatically get defensive and say, well, are you calling me a racist, or that I'm the cause of this? And, you know, and at the end of the day, we're not here to blame people, but we're here to help people understand how racism, which does exist, and how the perception of racism both cause trauma, micro traumas that build up and that actually can cause physiologic negative outcomes in people. And so I love that you broke it down, and I hope that the students are listening and paying attention, because we've got to find a way to talk about this on all sides. We've got to be able to talk about it openly and honestly, but we've also got to make sure we're talking about it in a way that doesn't blame people and shut them down.
I agree. Thank you very much.